All right. Well, it's 11 o'clock. So why don't we go ahead and get started? I want to welcome everyone to our coffee hour this morning. And I am excited to tell you that we have with us probably really a lot of the brains behind this operation. Some of the brains that have been part of this operation even before we got started. Brad Paulis, who's our actuary, has been involved with Kendal at Home since before we were even conceived, and has been involved in all of the science and strategy behind what makes this organization work. And Bernadette O'Toole is our auditor, which normally I would say, oh, but she has been a great partner. And, Bernadette, I still remember when you has submitted for the RFP as we were getting a new auditor and thinking, what does she know about Kendal at Home and the at home programs? And you have certainly leaned in and become a real partner with us over these years. So it's great to have both of you. I can tell you all that I rely a great deal on both of them, and they are the go-tos when we have any questions about strategy and finance and how this is going to work moving forward. And it was really Brad who really encouraged us to consider expansion of this program as we are now undertaking. So, and last but not least is Karen Graham, who's our CFO. And, a few years ago when we became an independent affiliate, one of the things that Kendal Corp said is you have to become independent, stand on your own 2 feet. And we have 4 feet. I couldn't do this without Karen for sure. She's been a great addition to our team and is really not just the finance person, but a great thinking partner and strategic and all of the things that we're trying to accomplish, and very creative. So I appreciate having such a strong team as we embark on this journey going forward. But I want to welcome everyone here and just give you an idea of the format. I've got some questions that I'm going to be asking our three guests. I want to tell you that you're in charge of how your screen looks. So if you go on my computer, it's the top right and it says view. And if you click on that, you can be in gallery view and you can see everyone, or you can be in speaker view and you'll see only the person that's speaking. So it's whatever your personal preference is. And throughout, you can ask questions or enter any comments in the chat box at the bottom of your screen. Sometimes it's at the top, depending where you have your toolbars, but you'll see chat or Q&A, and you can type your questions in, and we will try to incorporate them throughout, but we will certainly leave time at the end for people to ask any questions. And we already have a hand raised, so Barbara, did you have a question you wanted to start out with before we got started? I'm going to allow you to talk if you want to unmute yourself. Okay, I guess not. All right, so that's another way of doing it. You can raise your hand and I'll call on you and try to allow you to answer a question, but you do have to unmute yourself at that point. So anyway, well, we're going to get started and we're going to talk about finances. Barbara, I don't know if she came back in and wanted to ask a question. All right. So my first question for all of you today is, what financial security does an at-home product supply? And Bernadette, do you want to get started?
Sure. Can you hear me okay, Lynn?
Yes, I can.
Okay, great. So good morning, everybody. It's nice to be with everybody this morning. So I'm going to give my perspective a little bit on the changing healthcare environment and a little bit about what we see. As Lynn mentioned, I'm an auditor by trade, and we audit continuing care at home programs. We also audit continuing care retirement communities and also home-based Medicare services. So we do a lot of different providers providing services in different settings. And Lynn asked me if I would just talk a little bit about what we see going on in the healthcare market. So certainly, first and foremost, we see an increase in the volume of people that are looking for care and looking for services. I can give you the perspective of some providers we have literally can't keep up with the demand. We do some home-based care, and some of those providers literally cannot accept all the requests that they get for care because they're struggling to find qualified caregivers. So that's a real struggle in the industry. The shortage of people who are available to provide services, that are credentialed to provide services, and that's been a challenge in all settings. So in settings and home-based settings, and also in campus settings. So it's a challenge all around in the industry. We're also seeing, if you look at just demographics of the total demographics within the country, you're seeing just the number of seniors increase. The percentage of the population that's going to be over 65 is going to a pretty high level. And all of that together is placing some pressure on Medicare and some other insurers as it relates to costs. And so we see the industry kind of morphing a little bit, trying to control costs. And to that end, we see more home-based services being provided because home-based services are a lower cost of care than a campus-based setting or a short-term rehabilitation, for example. And then what other trends that we see is increased coordination between levels of care. One of the studies that was a pretty famous study done talked about care transitions. And one of the focuses of care is to reduce hospital readmission. So after somebody has gone home from the hospital and, they basically track them to see if they're readmitted. And what they found out when they were doing these kinds of studies is that there's a high likelihood in that transition of care period where people will end up being readmitted to the hospital. So the care transition was a critical part of that person's care and making sure that that was managed very well so that the person would be safe in that new environment. So we see a lot more, I'll say, cohesiveness between care settings. So when you're being discharged from an acute-based setting, such as a hospital or health system, going to either home or a campus-based setting or short-term rehab, there's a lot more focus placed on that care transition. And so within this new system of care delivery, there's definitely a focus on reducing costs, prevention and wellness, so identifying any problems that somebody might have before they become an overwhelming or acute care issue. There's definitely reduced lengths of stay in the hospital and rehab setting, and shifting of care delivery more to the home-based services. There's also a concept of pay for performance, where hospitals, health systems will get paid more for delivery of care if they're able to provide better quality and if they're able to demonstrate that they provide better quality. And some indications of that are, what is your readmission rate to the hospital? So the lower, the better, right? We want people when they transition care to stay where they are. And also, quality outcomes. So there's definitely a focus on measuring how people are doing in those care settings. So Lynn, I'm gonna turn it back to you to talk a little bit about some of the services covered by the Life Care contract and the concept of the entrance fee and the monthly fees.
Great. I think just to follow up on some of the comments you made, Bernadette, that's probably one of the areas I think that Kendal at Home can really demonstrate some success, is that care coordinator is really key to reducing hospital readmissions. And our track record over the years has been pretty tremendous in terms of keeping people at home once they've been hospitalized and been discharged. The goal is really to help them have the care in place that they need and then be able to support them. It's interesting because this pandemic has certainly created some obstacles in that area for folks that are living in CCRC. So we have some members who actually live in a CCRC, and the restrictions around even being able to get onto the campuses for caregivers has been pretty tremendous. So those are challenges that, as you talked about, the caregiver shortages and all of those things that even are more complicated as we look at, what's happening in our world today. For many of our providers, they had to pivot in terms of being able to provide care in a safe manner, because typically caregivers would go from home to home and provide care to numerous members throughout the day. And that had to change once the coronavirus surfaced on the scene. We had to make huge changes in how we go about doing our business, as well as how our providers do as well. So it's created even more challenges for what is already a difficult setting. I'm going to ask Karen if she'll talk a little bit about the entry fee, monthly fee, and the whole model behind this, because she's really the expert at the table. I'd like to bring into the discussion as well, and let you and Brad kind of talk a little bit more about that, if you don't mind. You're on mute, Karen.
Sorry.
Okay.
Sure. So, when we talk about the financial security, it's really reserving your dollars today for care in the future. And I think part of the financial security is the security of having that care coordinator. Being able to, when you maybe are in a moment of crisis, or have a need, that they can help navigate the things that are difficult for the average person, things that we just don't do in our daily work the way that they do. So I think having that support system behind you is all part of the security, maybe not just the financial piece, but really all part of the security that an at-home program would provide. Do you want to talk a little bit about the contract, Brad, and then I can come back and fill in?
Sure. One of the things I was going to discuss was, and you sort of talked about, you are paying money up front to cover the care on the back end, and how that relates then to long-term care insurance, and what's the similarity and differences between the two. And they're both doing the same thing, but really, and as was mentioned earlier, that care coordinator, that is what the difference is between this program and long-term care insurance. Typically, for an insurance company, that care coordination starts when an event occurs. You need care. They bring in a care coordinator who doesn't know you, and the care coordinator really is focused on how much care you need and what are you eligible for. And that's what their focus is. What are you eligible for? And that's what's different about the at-home program, where the care coordinator in the at-home program is much more relational. They start on day one. They get to know you. And when care is needed, the focus really is on what the member needs. And I guess I didn't ever introduce myself. I am a partner with Continuing Care Actuaries. We focus on retirement communities, at-home programs, and we also work with 8 different long-term care insurance companies. So I'm very familiar both from the insurance side and the at-home side, and what those differences are.
Brad, if I could just add one thing to what you said, talking about differentiating between the at-home product and the long-term care insurance and that care coordinator. I think one of the key things that we've learned over the years is that care coordinator isn't just coming in a time of crisis when you're sick or in the hospital or needing care after you've met that elimination day period, right? So, and that varies depending on policies that people have, but and many of our members do not have long-term care insurance. Some do have both, and we'll talk a little bit more later on about how the two work hand in hand. But I think it's one of the critical differences is that ideally the care coordinator knows the member and has a sense of what's important to them, and what are some of the nuances around putting a care plan in place, because they've had that relationship with them. It didn't start the day that they got sick or had surgery. It's a relationship that's been built in some cases for many years. So I think it provides for an easier transition as people begin to go into care at any given time. Karen, you want to take it back to you?
Did we answer that first question fully?
Do we think so? I think we talked about the entry fees, monthly fees, guaranteeing membership, preserving those assets. I think that, are we comfortable that we answered it? Everybody feels comfortable with that. So my next question is, how is it different from long-term care insurance? And we have talked a little bit about that. Brad, do you want to talk a little bit about how that discount works, how it starts from the beginning and how it transitions over time? And I think we can add a little bit to it based on experience over the years with long-term care insurance.
Sure. So as I mentioned, I do work with both long-term care insurance companies and at-home programs. And so as I was doing my work with Kendal, they asked me, what can we do if someone walks in the door with a long-term care insurance policy and they don't want to give up that policy? And so we worked with them in terms of developing a discount and basically creating a wrap around that long-term care insurance policy. So you can get credit for whatever benefit you're going to get from the long-term care insurance policies, because you're not going to collect the benefit both from the program and the long-term care insurance company. And so you can get a discount on the monthly fees in the at-home program, which basically you're getting a discount on the monthly fees from day one that really offsets whatever benefit we expect you to get from that long-term care insurance policy. And so that way you can take advantage of the at-home program care coordination, that care coordination, which is vastly different from what you'll get with the long-term care insurance company. And then the at-home program also sort of fills in the gaps from the long-term care insurance company up to the limits of the at-home program. If those limits are greater than the long-term care insurance policy, you would fill in that gap. If there was a deductible period, the at-home program would fill in that. So it's a great sort of wraparound to that long-term care insurance policy.
And I'd say just the other advantage for those that have long-term care insurance is the care coordinator is doing all the legwork. So they submit the paperwork, they track everything, they work with the insurance company. Our finance staff are helping to facilitate that process. And if you've ever experienced anything like this with long-term care insurance, just thinking about when you're not feeling well or you've just had surgery and now you need some help, and having to go through all the hoops that are required in filing a claim, I think often I would think that people go without ever getting benefits they're entitled to because of that process. So it is one of the advantages that the care coordinator does work with a member. We get calls a lot, though, during the year as premium adjustments take place with the long-term care insurance companies. And members will call and say, I just want to drop my long-term care insurance and have my monthly fee go back to the regular fee. Karen, can you talk a little bit about why that doesn't work? And I know it relates back to what Brad just talked about, but I think it's worth explaining how that process works.
Sure. As Brad had mentioned, you're getting credit up front for reimbursement dollars that we anticipate seeing later on. So in the case that someone may want to reduce or either reduce their policy for a lower premium adjustment or get rid of their policy altogether, there's the issue of the discount already provided. So that, if somebody chooses to do that, sometimes, it happens pretty quickly after they become members. But over time, that discount that they've been provided builds up. And so, 5, 6, 7 years into the program, in owing that back, you basically have to pay back the discount that was given to kind of make your contract whole again. And, that could be thousands of dollars just to get back to this break-even point of your membership entry fee, monthly fee being where it needs to be. So it's difficult. But what we have done for lots of people is kind of sometimes it's easier to stomach the premium increases when you look at it. Here's, I might have to pay 25% more, but if I don't do that, here's what here's what I would owe back to Kendal at Home, and here's what it looks like going forward. And so sometimes it takes this number that people will see as this, oh my gosh, it's 25%, and it makes it a little bit smaller emotionally once you realize what it could be if you have to pay that discount back.
Great, thank you. So I'm going to shift gears just a little bit, but I think probably one of the questions that people ask as they're considering Kendal at Home as an option, and even sometimes after they've joined the program, is how do I know Kendal at Home is really going to be there for me to support me in the future? And I'd like to ask that each of you weigh in a little on this one. So Bernadette, do you want to kick it off?
Sure. So as you guys know, Kendal at Home is a 501c3, which is a tax-exempt organization. And so it's exempt from paying any federal taxes from the IRS. And probably what you might or might not know is that there's a whole bunch of transparency measures that Kendal at Home is required to report on its annual 990. And most of them are centered around the fact that they are considered by the IRS a public charity. And the primary role of the organization is to fulfill its tax-exempt mission. And so when you look at the 990, you know that the mission is centered around supporting people in their homes as they age. And when Kendal at Home does that annual filing with the 990, which is their annual tax filing, it asks about best practices. It asks about, there's a lot of things for nonprofit that are distinct from for-profit organizations. So one of the most interesting ones is that there's no private enrollment. So what that means is that nobody personally who's working with a nonprofit organization is going to benefit based on the performance of the organization. So I'll give you an example. The IRS always focuses on salary and on transactions, and it asks Kendal at Home to demonstrate that the salaries and other goods and services purchased are purchased at fair market value. So in direct contrast with a for-profit organization, a for-profit organization might pay a bonus or pay over, if they're dealing with a particular company, pay a little bit over market value for goods or services. A nonprofit is expressly prohibited from doing those types of transactions. So there's very specific questions about how do you make sure, Kendal at Home, that you're doing these things and they're all at fair market value. So there's a lot of processes in place and that need to be disclosed on the 990. So no private enrollment, no excess compensation, and the concept is that there's two kinds of distinctions here. The board of trustees and the board of directors is responsible for, at a high level, for making sure the organization is complying with its mission. So the governance, meaning the board, is responsible for strategy, for oversight, and for accountability. And so boards typically have, minimum, I'll say maximum term limits, whereas that nobody's on the board forever. There's a cyclical rotation of board members, and ideally you'd have a board representation with a good complement of professionals and other people, so maybe some members on the board, maybe also a complement of professionals. So very often there's a financial representative or some legal representatives. So various expertise skill sets around the table to help the organization and guide the organization as it fulfills its mission. And that's the oversight function. Now management, of course, and that of course is Lynn and Karen and others within the program, are responsible for the execution of the strategy. So they're more responsible from a day-to-day operation perspective. And I think at this point, maybe I'll turn it back to Lynn. There's some other questions. I'm not sure if we want to go into those at this point or if we just offer anybody else to offer some perspective on this.
Yeah, I'd certainly like for Brad to weigh in and Karen as well on our financial viability as we think about, will we be there in the future? Brad,
absolutely. One thing is that Kendal's growing, and there's two specific benefits that they get from that growth. One is from an administrative cost per member. That's been decreasing over time. And so just from an operational standpoint, they're becoming leaner, and they're just getting better from a cost perspective on the administrative side. And the second is, as we look at projected care costs going out, as the program gets larger, the variability of that care cost decreases. So just the finances improve as the program is growing. And the other thing I've encouraged them is on the investment returns, that they focus on 10-year returns. As they collect that money up front, they are investing it, and they have separate investment advisors. I am not the investment advisor, but they focus on those 10-year returns. And I assume in my pricing, very conservative assumptions in terms of return. But as they focus on those 10-year returns, they're always going to have good years and bad years, but they can maximize those returns while minimizing risk overall by focusing on those 10-year returns. And because of the nature of the collecting the money up front and then providing care down the road, they can do that. And then the third thing is that we are doing pricing studies. We analyze their pricing on an annual basis. We're looking at their members' history. Who are they bringing into the program? Who's using care? We look at that on an age and a gender basis, and also how long people have been in the program. And from that, we then project future costs, and we're evaluating that pricing on an annual basis, and we're evaluating their funded status and making sure that they do have enough assets and future income to cover that cost in the future.
Thank you. Thanks, Karen. Do you want to add anything to those two?
Sure. So, I think my role is to work between both of these advisors. So, what do we do on a daily basis to make sure that we're supporting that funded status? What choices are we making? How are we budgeting? How are we using our dollars most efficiently? And then also from what Bernadette said about the 990, I'm really proud of our 990. I'm really proud of the allocation of how our money is spent. And I think that comes back to, it really starts with our value system. And when we say things like we're a lean staff, it's not because we want to be cheap. It's because we want to preserve the dollars for what they're meant to be for. And so it's a mindset. It's a whole different approach to how we do our day to day. It is about making sure that these people that have entrusted us with their future, with their aging process, that we're there for them. And that is front of mind in every budget. As I'm just finishing our budget process, all of this is running through my head. It starts with that. That's not how do I make this look better on the 990? It's never that approach. It starts with these members and what we are here to do for them. And then my job is just to make it all work beyond that.
Yeah, if I could just add to that, I think, it's hard not to think about how things have changed over the last few months, but being such a lean staff and having something like a pandemic occur that we were all totally unprepared for, to the magnitude that we've experienced over these last several months. I think having been more proud of a team that leaned in. Every single staff person began working with members directly to make sure that everyone was okay. Obviously there were members with critical need who were very isolated, and we chatted a little bit about this early on as we were getting ready to start this morning, what the overall impact of this will be in the years to come. But I don't think we could expect more of a team that leans in, and no matter what their role is, the member is the number one focus and has been over these last several months. Sometimes I think members are, where's my care coordinator? And their care coordinator is still there and still working with them. But, we always had this emergency plan of we all pitch in a snowstorm, but, that's gone in a day or two. This isn't going away for a long time. So really looking at everyone's ability and commitment to that mission to lean in has been critical over these last several months. I think one of the things that prospects ask and members call and ask sometimes as well, why is my monthly fee going up? Brad, can you talk a little bit about how you're building that into the actuarial assumptions. You just talked about doing that study, and we know that affects entry fees for people coming into the program in the next year. But what about the monthly fees? How does that calculate?
Sure. We have built into the model that we're going to assume inflationary increases, and we are looking at what are administrative costs increasing, how are the salaries increasing, what's your core inflation, what's an hour of companion care increase, what does a day of nursing home care increase. So we're looking at that core inflation. We expect that those monthly fees will go up with inflation. And one of the advantages of doing that is that we can keep those initial costs a little lower by assuming those inflationary increases. And you also won't have the shock increases that you're seeing with long-term care insurance providers, where they advertise level fees, but they're really only, if you look at the pricing of them, level for 5 or 10 years, and then you wind up with those shock increases. And so by doing inflationary increases, you can minimize the need for anything like that to occur. And so we have that built into the model that we're going to have inflationary increases.
And I would add to that, that along with those inflationary increases, we're also increasing our coverage. So as the cost of care increases, our coverage increases as well. And so I think the two go hand in hand. It's really important to think about how that prepares you for what lies ahead in terms of future care costs. You know, if we look at where that was when we started and where it is today. The other thing I'd ask to touch on is tax deductibility, because that's a big question. And at this time of the year, it's such an incentive for people to make sure they're taking those steps before the end of the year. Bernadette, Brad, either one of you, Karen, want to talk about tax deductibility and how that works?
Well, I'll start and then I'll throw it over to Brad.
Okay.
So, what we see in anybody offering the kind of life care product is that the IRS does have a number of revenue rulings out there that have changed slightly over the years. But really what it says is that when you enter into this type of a life care product, you are entitled to a medical expense deduction for the entrance fee, for the non-refundable entrance fee and into the program, and also for a portion of the member fees on an ongoing basis. And that's determined slightly differently for each community or each at-home program. So that's definitely available to you and very attractive to you. One question that did come up in the, somebody had sent a question in advance, is that subject on the Schedule A for the individuals 1040 to the regulatory, I think they use 7.5% of the AGI. And to answer that question, yes, it is subject to whatever the deductible percentage is at that time. So, 7.5, it's going to go up to 10. So there are some limitations on that, but also when you consider about it, it's a pretty hefty deduction considering it's a percentage of the monthly fee, and especially in that year where you're paying the entrance fee. So Brad, I'll turn it over to you.
Well, and that is why we structure that deductibility the way we do, doing 100% of the membership fee, and then the 65%, I believe it was last year, of the monthly fee. So you can maximize that deduction, that membership fee, get it over that 7.5% limit. So we have structured that so that members can sort of maximize what that deduction is over the long term.
Thank you. Karen, you want to add anything to that?
I wanted to add one thing from the previous question. When we talked about the, how do I know Kendal at Home is going to be there in the future? And I think we do have to mention our underwriting process that happens. Mm-hmm. And making sure that we're diligent with that. We are really looking at any known risk factors up front and identifying those. So I think that that's an important piece of making sure that we're there in the future. Bernadette, you talk about that often and remind me how important that is.
Right. And I just wanted to mention something about the previous question. When I was listening to Brad talk and listening about the inflationary, adjustments that are made throughout, that goes right back with the concept of a nonprofit and the the concept is that they're required to be good stewards of the assets of the organization. So in that way, they're not overpaying for goods and services, they're not overpaying for compensation, and that allows them to take the overages, put it back into fulfilling the mission for the organization, and thereby making sure that those inflationary indexes, even though the cost of care is going up, that they're kept at a minimum because they're not overpaying on either the compensation side or for goods or services.
Thanks, Bernadette. And also, I think our wellness program has to be a factor in that as well. Really making sure that, I guess it could go under this question, and also the difference between long-term care insurance, because our focus when care is in place is always to regain that independence, to make sure our well members stay well. If there's an acute situation that, we're working to regain that independence for them so that their care dollars that they've put into the program stretch for their whole future. And so the prevention that we can do, the lots of the wellness programming that we have in place is really to preserve those dollars, to preserve that independence, and make sure that that's there for them in the future as well.
Yeah, I think, focusing on quality of life, and nobody joins this program because they want a good nursing home placement. They want to stay healthy and well and remain at home and involved in the things that are important to them. And that's our goal, as we work with each individual, is to make sure that we're helping them to achieve the goals that they've set forth. And that's different for everyone, and everyone comes from a different perspective on that. One of the things I can't help but think about since we started is how difficult it is, as Karen talked about, that underwriting process of turning people away. So someone who already has a progressively debilitating diagnosis. And, years ago when we were faced with that, and some of the people who really needed help the most were the people that we had to turn away because they didn't qualify for life care membership. We have developed a Care Plus program, and we have members who join the program who otherwise wouldn't be able to. They don't have the same life care benefit in terms of unlimited, benefits for their lifetime. They have a package of services, but they have the greatest benefit, and that's the care coordination. And that has made a difference, a tremendous difference for people who might otherwise have not been eligible or might not have been able to benefit from the program. And I wanted to add one additional thing on the tax deduction. I can assure you that there have been people that have gone to great lengths on this tax deduction. We had a couple who joined the program, paid their entry fees, went to do their taxes, and their tax advisor said, "Why didn't you split this up over 2 calendar years? You'd have really benefited from that deduction." So they withdrew from the program, rejoined, paid one entry fee 1 year and one the second year, and of course triggered the IRS and had an audit. But the IRS did uphold our attorney's advice on the tax deductibility. So we've been tested a few times, and we know that it has been supported. That opinion's been supported by the IRS. But what I would encourage, if there are folks who are on today who are thinking about joining, especially if there are 2 people in a household or even just one, is to take advantage of the end of the year. We always offer some alternatives, but you can pay one entry fee in this last quarter and the other in the first quarter of 2021, and take advantage of that tax deduction over a 2-year period. But we would advise you to please talk with your tax preparer first to make sure that that works to your advantage. It's based on, as Bernadette talked about, that adjusted gross income number as well as your income. So find out what would work best for you, and think about taking advantage of that during this last quarter. It is our biggest quarter of the year for membership, and I believe it's for that very reason. We do have one question before I get to my last question, and that is, if I would choose to pay the monthly fee in a lump sum for the whole year at once, could there be a discount? Brad, I'll turn it to you.
I knew you were going to ask me. We've never discussed that, but I can certainly get with Karen and discuss that. possibility. I mean, my guess is something could be worked out on that. But truthfully, I work with a number of at-home programs. We probably do about 70% in the industry, and I haven't been asked that before. So let Karen and I get together and discuss that, and we can get back to you on that question.
Thank you. Thanks. So the last question that I would ask all three of you is, what gives you peace of mind about at-home programs, but specifically Kendal at Home? Brad, I'll let you start this time.
Okay. I want to tell you a little about myself and two things that really influence my thoughts on this. So one is, I know how expensive long-term care is when you need it. It just can be very expensive. And the second is, I've actually had to deal with coordinating care in my own family. And I work in this industry, and I found it daunting. To find the right caregivers, to make sure they're showing up, it's just a daunting process in terms of trying to coordinate a family member's care. And so I understand the data, and I know that when we aggregate the Kendal at Home members, while we don't know which members are going to need care, I do have a good feel for how much care in total is going to be needed. We know how to project those expenses. And I see the value in the care coordination with Kendal at Home. I wish I had this in the state I live in, and we don't. And just because of my personal experiences, I just see so much value in the program.
Thanks, Brad. Karen, how about you?
So what gives me peace of mind about Kendal at Home? Was that your?
Mm-hmm.
I think it's got to come back to the team of people that are here and leadership. It has had Lynn as our sole CEO from the beginning, and the longevity of the people that are here. There's not a lot of turnover, and people, it becomes a family. And so it's this core family helping all these other families. And, I was recently had a conversation with a prospect's financial planner. And at the very end of it, he said, "Can I ask you a question?" And so I thought, well, what else? We were on the phone for an hour. What else could he possibly have to ask me? And he said, "Would you choose this for your own parents?" And without hesitation, I said, absolutely. And so knowing that I would do it for my own, I think that was my most honest answer to him was, yeah, I would absolutely choose it for my own.
Thanks, Karen. Bernadette.
Yeah. So I have to echo a little bit. I relate to what Karen was saying in that, I definitely had the experience of trying to help my parents as they went through finding care and various, hospital stays and at-home stays, and the difficulty they had adjusting to caregivers that would come after an acute stay. I think they would have really benefited from knowing that, first of all, having help setting up that care, and second of all, a personal relationship would have been so important for them in trusting the people that were coming into that home, making sure there was a watchful eye, making sure basically everything was as it should be. Very difficult to do that when you're having a health crisis. And I saw my parents go through it, and they had a lot of different people come into the house. Some they didn't like, some they felt weren't giving good care, that kind of thing. But as far as working with the Kendal at Home program, I can say that there's a diligence and a discipline in their approach to the care coordination services, the financial management, the actuarial and pricing studies. All of those things together give me a peace of mind as far as, they're planning to be around for the future. They're exercising the due diligence. They're managing, and they're being good stewards for their members. So that gives me peace of mind from a professional standpoint.
I just add to that is, and Bernadette, I think you touched on this earlier.
Of Claggett, you really don't have
Sue,
any.
we can hear you. Sue, you're not on mute. The governance and the board of directors has been critical as well. And again, over this last year, we typically meet 4 to 5 times a year as a board, and then there are finance committee and other meetings in between. But, the diligence of the governance and those folks that are committed, and our board does consist of Kendal at-home members. In fact, we're in the recruitment process now, and there is a position open for a Kendal at-home member, if anyone out there is interested. But the focus on what are the talents and treasures we need on the board, and looking at diversity and inclusion is certainly a critical priority for the board right now. But as we embarked on this pandemic, the board has leaned in, and we have monthly meetings. And I think in addition to the monthly touch bases, so we have a touch base every month that we're not meeting as a board. We also have added a couple of board meetings because of been so, critical issues to be addressed with the board. But even as we consider growth, and we are looking at growth, we are already in most areas of Ohio, but now looking at growth in Massachusetts, partially in partnership with one of our Kendal affiliates, but now looking at it from a much broader perspective. There is a strategic opportunities task group of the board that's really evaluating the growth fund and those opportunities that we are considering. And they are leaning in. They meet at least weekly, if not more often. But there's a commitment from the board of directors that's an incredible asset to this organization that goes well beyond. Our board members aren't paid. They don't get compensated. They get a box of chocolates at the end of the year. But I mean, really, they are in it for the commitment to the mission and what we do. And they've never been more committed, I would say, than what we have seen over this past year. And I would echo Karen's sentiments that having a team of folks, both from a governance perspective as well as feet on the ground in terms of staff that are so committed to this work. And, I think having been in this field we've been around, it'll be 17 years in December that I've been here. I thought I'd only stay for 2. I went fast. But I think, along with Brad, we've seen this industry grow from just a handful of programs. When we started, I think we were the 5th program across the country and remained that for a long time. But we now see about 30 or 35 programs, either in operations or in the beginning stages of opening their doors. So it is a field that is growing, and I would venture to guess that as a result of this pandemic, we'll see a lot more focus on home and community-based services. I had an opportunity to meet yesterday with Katie Sloan, who's the CEO of Leading Age, which is sort of our national trade organization, really focused a great deal on the home environment and how that desire for people to remain at home is going to grow much greater throughout this time period. So we're here to look at opportunities and how we might strengthen and grow this organization. But I can't thank you all enough for your time today. I do want to open it up to questions from anyone. If you want to raise your hand, I can allow you to unmute yourself and talk, or you can simply type a question in the chat box or the Q&A box, and we would be happy to try and answer it for you if you have a question. And Jody, I'm going to allow you to talk if you'd like to ask a question. I see your hand up. Can you unmute yourself, Jody?
Got it.
There you go.
It wasn't there before. I can type things in a chat box, but I can't make them leave. What's the magic?
We can make that go away once we answer your question, actually.
Okay, but I mean, this is throughout my whole time with using Zoom. I can type things in a chat box that says to everyone or something, blah, blah, blah. Sorry about the phone, but go away. But I don't know how to make it go to you.
Oh, you just
hit your return key.
Yeah, hit enter and the question will go to us.
Thank you.
You're welcome.
And I have another question, not quite on this, but because of something I know. When a member goes to the hospital for something or is sick at home, do you want to know about that even if they don't need help at that point?
Yes,
I thought
absolutely.
so. Thank
Mhm.
you. That's what I thought. And
Absolutely.
I think it would be helpful if that could be made better known to members, because speaking for myself personally, I don't want to bother you all if I don't need anything. And I remember when Dave was my care coordinator, we had this conversation. He said, just let me know, and then I can be better
Right.
prepared if you need something.
All
So I
right.
just like to,
Sometimes I think we don't know what we need or what we could benefit from, and it might be the smallest of things, but it could maybe just be helping with preparing, having some meals prepared for you when you get home, or but whatever it might be. I think it's really important for the care coordinator to know and be aware. And maybe there are some things that they can do to help support you to prevent something from happening in the future. But we want to make sure you're going to have the best success once you get home of remaining at home and regaining that independence. So it is important to know if there are any changes, not just that you're in the hospital, but if there's any change in your health status, it's important, I think, to share that with your care coordinator and let them know. Thanks,
thank you.
Jody, for that
I
question. I
think it is.
appreciate it.
I learned that lesson. I had the norovirus and was really sick for a while. And I called Dave, and I didn't need anything at that point because I was kind of on the upswing. But he said, would you like for us to send want somebody there overnight? Well, my son could come. Do you want, should we send somebody in tomorrow to help you? My mind was absolutely blank. I didn't know what he was talking about. I'm thinking, send some. I finally said, do you mean like a home health care? He said, yeah. What would they do? He said, well, they could do light vacuuming, laundry, prepare food. I said, okay. It was a godsend. She did 5 loads of laundry, I think, stripping beds, washing everything. And it was a huge help. So that was my real lesson in give a heads up so a care coordinator can be on top of things.
Absolutely.
So thank you.
Absolutely. Thanks, Jody.
You can mute me now.
Okay. All right. Any other questions? Did anyone else have a question? Great. Well, we want to thank everyone for joining us today. And certainly Steve and Lindsay are on in the background. So if you are thinking of, or considering Kendal at Home, you can certainly reach out to them. If there is a question, are the actual in-home helpers you coordinate with vetted, bonded, insured, licensed, et cetera? And yes, absolutely. Our providers, no matter whether it's a home care provider or a home or home inspection crew that comes in and does your home assessment, everyone has to go through a credentialing process. They have to sign an agreement with us. They have to name us as additional insured, and they have to demonstrate to us that all of their employees are vetted as well, that they're criminal background check, drug tested, and meet the criteria that we require in order to be a credentialed provider. And we need to have proof of their insurance, and we have certain limits of liability that are required by our risk management insurer as well. So all of those things are in place, and you can be assured that we've had a caregiver put a hot pot on a countertop and, burn mark, and they pay for those damages. Those things are covered under your contract. So we do assure that our providers are covered. And one of the most important things to think about is, for individuals who hire folks privately to come in and care for them, if they have an injury and file a workers' comp claim, that individual who's employed them becomes responsible, even if they were paying them under the table. They become responsible for the workers' comp claim. They're responsible for any insurance or liability and taxes, all of that. So people put themselves at great risk when they're not credentialing or utilizing an agency that has those credentials in place. So it's really critical to make sure that we have all of those pieces in place to protect our members and our organization. As stewards of all of the dollars in this program, it's our due diligence to make sure that we're protecting everyone as well as the organization. So I just want to add that we are going to have an additional coffee hour this month, and it's on October 20th at 11 a.m. And our guest is going to be Kendal at Home member Jonathan Enton, who actually served as a law clerk for Ruth Bader Ginsburg. And so we've asked him to join us for a special event on October 20th. And we'll be getting more information out to everyone about it, but wanted to give you a heads up so you can mark your calendars and join us for that event if you're interested. But we want to thank everyone, Brad, Bernadette, Karen. Thank you all, not just for today, but for all of the support that you provide for all of us and for helping us to remain a strong and viable organization all these years. So thanks to all of you and have a great weekend, everybody.
Thank you.
Thank you.
Thanks. Thank
Thank
you.
you.